Good afternoon, everyone. Thanks for being here with us today. I, Ankit Dogra, along with my teammates Dr. Deepika Chhabra and Mr. Amit Saxena from Medical Services Jagsonpal Pharmaceuticals Ltd, are very pleased to welcome you all to the today's question and answer session on the recent development and future interventions in COVID-19, organized by Vaccine India, Vaccinate India, Delhi Medical Association, and Mera Swaasth Physicians Network, with digital partner Jagsonpal Pharmaceuticals Ltd, makers of LycoRed Cell Protector, soft gel capsules of lycopene, zinc, and selenium for boosting immunity and cell rejuvenation. Dear attendees, if you have any questions, suggestions, or clarifications, please post them in Q&A box. Please note this webinar is streaming live on the Facebook and the link has been shared in the chat box. Also note, for future reference, we'll upload this webinar on our YouTube channel, Jagsonpal Medical Insights. Now let us welcome the moderator of the program, Dr. G.S. Grewal, sir, President, Delhi Medical Association, to kindly initiate the program.
No, I am moderating. Dr. Grewal has not joined yet.
Oh, okay, sir, kindly.
Last time with Ganga Khedkar, he was doing that. So, welcome all on behalf of Vaccine India and Delhi Medical Association. Privilege of take question and answer by expert, the chief of the COVID task force, Dr. Arora, and chief of the NTAGI. So he will brief us on the latest situation and then we'll take the question and answer. Before that, we have National President from Patna, Dr. Shahjanand Singh, who has joined, and his activism as he was in Delhi and meeting all the ministers and the bureaucrats to do that. So he's in OT. So I'll just request him to say a few words for a minute, and you can continue your operations, sir.
Respect our Gambhir Sahab, Dr. Arora and Ankit Dogra ji. A very good subject which we have chosen here, very burning subject. Our learned Dr. Arora will speak about this corona. So I'm in operation theatre, sir. I'm doing operation. Due to request, I have just appeared, sir. Please.
Thank you, Dr. Shahjanand, for your blessing. So,
I wish, Jay.
So we have been having alternate week programs with Dr. N.K. Arora and Dr. Ganga Khedkar, and we are getting good response. A lot of queries have been raised, and I hope you will like today better. So I request Dr. N.K. Arora to brief on, because he is the person and his team, along with the Government of India and NTAGI, is working. So will let us know the latest situation, and then I'll start with the question and answers. Professor Arora.
Okay. Yeah. Thank you, Ajay and Dr. Shahjanand Singh ji. It is such a pleasure that you are based in Patna, because I am deeply associated with Patna AIMS. So maybe next time when I come, I'll certainly come and see you. Thank you for the opportunity, and I'll just brief you what has been happening in last few weeks. Uh, India had the first case of Omicron in the first week of uh, December, and by second week of January, it had practically taken over Delta. Delta was at that time about 60%. Another 40% was Delta Plus or AY series. But in last 6 weeks or 7 weeks, Omicron has completely taken over. And in fact, we have vaccine tracker information from the ICMR, which shows that monthly breakthrough infections in fully immunized individuals was about between 5 and 8% in different months. And be it Covaxin or with Covishield, the breakthrough was around the same. First 3-4 months, very few, less than 1.5% breakthrough is there. But after that, about 5 to 8% breakthrough occurs every month. But in the month of December and January, this breakthrough increased to 31%. So that means the vaccine escape effect, which we know about this virus, is very much there. And whether one is fully immunized or not, the infection is very widespread. Today, almost 34 states have over 90% of Omicron. Only 5 to 10% of the isolates during last 2 weeks are Delta and Delta Plus or AY series. Having said that, the country made huge preparation after the second wave, and we know all of us are clinicians who are attending that health system is strengthening in the form of increasing the bed capacity, increasing the both pediatric and non-pediatric beds, ICU beds, ventilator beds, oxygen beds, they were increased. And so the country was prepared to to handle up to 10 lakh cases per day. But fortunately, we see that the peak seems to have already been over. The peak was around 3.65 lakh cases in a single day. I think that was 21st of January or so. But only about less than 10% of the total health system capacity has been used so far, which again shows the decoupling between the burden of the disease and the burden of individuals requiring hospitalization, oxygen therapy, ventilation, ICU. But having said that, several deaths are still occurring in those, particularly those who are having comorbidities. Therefore, one of the first lessons is that even though we may be immunized completely, if we get infection, the possibility of it becoming serious particularly increases by 7 to 10 times if we have morbidities, which like diabetes, hypertension, cardiac disease, any other malignancy, or any other comorbidities involving various organs. So it should not be considered as an innocuous disease. And so deaths which are occurring, which is about less than 0.2% or 0.3% of the total cases reported, a lot of them are due to Omicron, and we just cannot pass it through. The second thing is that currently whatever the number of cases we are seeing in the press, it is just indicative. About 16 to 18 lakh tests are being done every day, and it shows positivity of around 10, 15, 17%. There was a time it was 26%. Now it has come down. So positivity rates are very high, but simultaneously, almost every day, 4 to 5 lakh home kits are also being used, or rapid antigen tests are also being sold. So it means a lot of people are getting it tested in at homes, but these are not documented into the national database. Two, number three, that in last 2 weeks, there is a decline in the number of cases in about 30 odd states and union territories, which again shows that this is there may be we may have passed the peak, but still one has to be careful because there is fluctuation in between, and therefore be cautious and very rigidly adhere to corona appropriate behavior. Now, so that is the overall situation. The second is availability of drugs and other things. I am first hand witness the way national pharmaceutical monitoring is taking place. In fact, the government today knows how many paracetamol tablets are available at various levels, manufacturer's place, the distributor, and the retail shops. So that's the degree of monitoring which has happened, so that there is no shortage of any drugs. And I'm sure most of us must have experienced that this time there is no hoarding also, because I think people have confidence. Third thing is, now coming to the vaccine part, the the vaccine tracker is showing clearly that if somebody is immunized with 2 doses as of December and January, if somebody is immunized with 2 doses, the risk of death is decreased by 98.7% or so. And if somebody has received even a single dose, the protection is 97% or so. And the reason for such high protection against death is because we have a unique epidemiology, in a sense that a large proportion of us were infected with Delta virus. And it is, if we take proxy from children, the seroepidemiology shows almost 80 to 85% of people in various demographic sections, various geographical regions of the country have been infected with Delta prior to this third wave. And now third wave, the way it is going on, nobody has exact idea, but it appears a very large proportion of us are reinfected. Many of us are reinfected despite vaccination. But fortunately, serious disease is not very common. So breakthrough is there in immunized individuals, but those who are hospitalized with severe disease or death, the full immunization is extremely rare in those cases. There would be some proportion, but the 2 doses of the vaccine are giving good protection. The neutralizing assays done in the country with Omicron virus now available, it shows that none of the vaccines used, and even internationally mRNA and the other J&J vaccines have very poor neutralizing capacity for Omicron. They may have better for Delta as compared. Omicron is much less. But despite saying that, having said that, again, it appears that cellular immune response probably is providing protection against severe disease. Finally, about the precaution dose. The precaution dose, we are deliberately not calling it as boosters. And the reason is that we are giving homologous vaccine. And homologous vaccine is being given that we do not have adequate data. Although theoretically and from the experience from the West suggests that heterologous boosting is better in terms of antibody response. But the overall effect, how much it makes difference in terms of final output, in terms of prevention from severe disease and death, is really not, doesn't appear to be too different. Although we see a higher antibody response if we give a heterologous. With the challenge and the fear of giving heterologous at this point has been that heterologous vaccination occasionally gives severe reactogenicity at local site. Otherwise, our program has done so well. I mean, we know adults, almost 96, 97% of all adult population in the country is now immunized. But meanwhile, booster studies have started with heterologous immunization, because we have 5 new vaccines, 2 protein subunit, Covovax and Corbevax. mRNA vaccine will be coming in next 4 weeks. Then we have intranasal vaccine. So, then we have ZyCoV-D, the DNA vaccine. And so there are plenty of vaccines available which can be given as heterologous. But since the experience was limited or no experience is available, and particularly with many of these vaccines, there is maximum experience is available heterologous for AstraZeneca or Covishield versus mRNA vaccine or vector vaccine and mRNA vaccines, and not with the some of the vaccines I just named. So there are studies going on, and based on the studies, if there is a benefit with no reactogenicity or lower reactogenicity, then the policy will be revisited to see if there is a need at that time. So with this, I will stop, and I'll be very happy to take some questions and try to answer them.
Thank you, Dr. Arora. And I was in Aurangabad yesterday, where the first Omicron was detected, and meeting the microbiologists, because to the Path Foundation, we have donated the RNA extractor. They had the DNA extractor. So this is how we have to improve the technology, as the periphery has to get the right thing. And all centers are equipped, and they were remembering you that through your network, you are doing a wonderful job. So the questions which I have received is, till the last moment, is one: could the Novavax vaccine help us win COVID war? Now, you have already told that these vaccines are not effective. Will Novavax vaccine or will be better than the vaccines which we are available?
So that is what I was trying to say, that the phase 3 trials with Novavax, or which is called Covovax in India, similarly with Carbovax, similarly with ZyCoV-D, Omicron neutralizing activity is much lower as compared to Delta. So it is behaving like any of the other vaccines where base is Wuhan virus. And but still one should not just give up because we are not seeing neutralizing antibodies. There is almost a consensus in the thinking process that almost 2/3 of the protection is provided by cellular immune responses. And cellular immune responses are reasonably robust, and they seem to work pretty well. And we should also understand that the current vaccines, irrespective of whatever the vaccine is, they are disease modifier. They are not affecting the transmission significantly. And therefore, prevention of infection is not the motive of vaccination. The purpose of vaccination is to reduce morbidity, to reduce severity, reduce death. And I think to a very large extent, the vaccines we have used in this country have succeeded in that object.
Thank you. So the questions are many, and we have divided, but as you were talking about the vaccine, I thought I should take the vaccine. But very important question, which you will have to brief the politician, other thing, that when do you think that the COVID-19 pandemic will end?
So somebody asked me this question, and I said on YouTube, there are several astrologers who are predicting the outcome of politicians as well as COVID pandemic. Maybe they can answer better. I won't venture into answering that question, because if in next 4 weeks a new variant comes, anything and everything can happen. So therefore, I think we'll have to wait and watch at least for next several months to see how it behaves. in India and also what is happening in other parts of the globe. And we know that the first infection was noticed around 12th of November 2021 in South Africa. And by 1st December, we had the case despite all efforts. So all of us have to accept that to say anything or predict anything or to talk about endemicity or to talk about herd immunity is both mythical and mystical. I mean, these are terms we have been using, but truly speaking, probably we cannot have any of the predictions at this time.
So, so you have to definitely brief the policymakers till the top. So, at least you can say that the question is: are we prepared for the next pandemic if this continues?
So as I said, I will just brief you and will try to give you confidence that even today in December, January, we were better prepared than ever. As I said, the country is prepared for up to 10 lakh Delta cases. That has been the preparation that we should be able to handle that. And this issue of continuing the strengthening of the system is going to be there. And you know that there won't be any deficiency of oxygen anymore. Beds, pediatric beds were less, but now all medical colleges have and big hospitals have been asked to take care of that. I was talking about medicines. All medicines which are required or being prescribed by the physicians across the country are available in adequate supply. And the fourth dimension is our INSACOG surveillance, which is genomic surveillance, is become more agile, and we are now able to provide week to week feedback to the government as well as to the country what is happening and if there is a possibility of any new variant. So the whole effort is to have a very comprehensive approach. Here I must also share with you that at least 3 companies in the country are also have started preparing variant specific vaccine. So DNA, mRNA, and even Carbovax. These people have started. Some of them are in much advanced stage. And particularly with DNA and RNA technology available in India, if we have a real bad variant, probably we are in a state where in 6 to 8 weeks, we can come out vaccine. So that on that front also, the basic science activity is also going on. And because I'm part of the COVAX facility, WHO COVAX facility, I'm aware that if a new virulent strain comes and variant specific vaccines are required, nobody will give us. We'll have to be totally independent in that, just like we have adopted the approach of being independent for the current vaccines. And so there is already a preparation for that eventuality as well.
You have answered partially that question. Should we prioritize the development of Omicron specific vaccine? Is that serious, or should we go for vaccination in Omicron, or should we wait?
No. I think the current vaccines are perfectly all right, and we should. In fact, it's such a fortunate situation. Probably we are the few countries where 96% of the adults are all immunized, at least one dose. So we have reached that. And it is because of that experience we had with polio. Ajay, some of you guys have been leaders during polio program, and all those strategies and experiences have been used to reach every adult individual. Most of the countries across the world are having difficulties, particularly low and middle income countries, to reach the adults. But India has been able to achieve that. In the peak, we were able to have 115,000 vaccination centers across the country. And each vaccination center is able to maximize about 200 vaccines. So that vaccination program has to continue, must continue. We have children vaccination has become a little slow, but I hope in coming days it will also pick up. As far as Omicron specific variant is concerned, and so that is preparing ourselves in case. That's why I use the word variant specific vaccine, that technologically we should be ready. Today we are able to produce Omicron within 60 days. In next time, if something else comes, we should have one, the laboratory wherewithal as well as the technology wherewithal. But simultaneously, there is an effort that regulatory preparation is also there, that the new vaccines don't have to undergo the complete rigmarole, all the processes, but directly can go into
Dr. Gambhir,
clinical
can I ask?
trial, just
Dr.
Yeah,
like
Gambhir,
adult physician, just like influenza vaccine.
Dr. Gambhir?
Yeah, please.
Bobby, welcome.
Yeah, sorry, first of all, Professor Arora, my apologies. I could not join earlier. I was in Gurgaon and the connectivity was poor. It's a matter of privilege for Delhi Medical Association to have a scientist of your stature talking to us. We are very proud of you, sir. So my question
My pleasure.
about the reaction to vaccine. Have we now come into the comfort zone of allowing vaccine to come into the general market?
So you are asking basically two questions. One question is the safety of the vaccines. Safety of the vaccine is not an issue. I mean, probably we are the country where we have used, as of today or in next 2 days, it will be 170 crore doses. But the more important is the regulatory processes. Regulatory, whenever emergency use authorization is given, those vaccines cannot be given in the market because they are under Pandemic Act or Epidemic Disaster Management Act. The third thing is, now when a limited market authorization has been given to Covaxin and Covishield, there may be a possibility that some of these vaccines may be available. But how and when these will be available, what are the guidelines? I think these are still getting formulated. And but I don't see immediately any possibility of this. But as I was mentioning to the group, that there are 5 new vaccines on the anvil, and they will also, 3 of these have already been given market emergency use authorization. So there is plenty of vaccine available, and I think some of these decisions are under discussion, and maybe in next 2 to 4 weeks things may be revisited, and you may hear some new things as well.
Sir, continuing with what Dr. Bobby had asked, you had answered. The question already given to us is, what is different between emergency use authorization and conditional use authorization? Because now
I have tried to answer that already, that conditional market authorization is where just like in an emergency use authorization or clinical trial mode, the company has to meticulously monitor adverse events, and safety pharmacovigilance system has to be set up by the pharmaceutical companies. So that is limited market authorization. That's what has been given. But still, the release into the market is not open, and the private sector can use as much as they want. But everything will have to be entered and loaded onto CoWIN if they dispense any vaccine. And they will have to go only by the national program. So if everybody cannot receive a booster or only as per the national guidelines, people will be allowed to do. So in effect, practically not much difference has it made. But I do understand what you guys are asking, that when will be available in open market so that people can use it the way they would like to. So there will be some time before that kind of a situation arrives.
the other part is that which I read was the emergency authorization. You are right; they have to submit their all the data weekly to the DGSA, and for the conditional use authorization, they have to do it quarterly. So some liberal, because after the safety part has been reviewed by the regulators, so so conditional use authorization has been given that. Today, the newspaper and also the data coming that 10%, is another question, that 10% of the people who have been vaccinated had a 2 dose, had mild or moderate infection, and some of them was admitted. Now, the future vaccines which you are part of it, are they are better, or you are taking this criteria that this breakthrough infection should be less?
So, as I said, currently used vaccines are using Wuhan strain as their base. So I also told you that within India, the breakthrough rates were 5 to 8%. In the month of December and January, it has become 31%. That's what I'm also trying to say, what you are saying, that there is large number of people who have fully immunized but have got Omicron infection. All these are most of these are very mild infections or asymptomatic infections. But whenever people get severe disease, almost all of them have severe comorbidities associated, uncontrolled diabetes, very high blood pressure, or chronic lung disease, kidney disease, etc. So, Dr. Randeep Guleria presented a data, I think yesterday or day before, and which shows that except out of some 242 uh, COVID patients admitted at AIMS during last 6 weeks, from 20th August, 20th December to 2nd February or so, only one individual had COVID pneumonia, and all had associated, uh, what should I say, associated comorbidities. The second thing is, I am sure as pediatricians and clinicians, we know when the vaccine coverage increases, then almost everybody who will get the disease will be vaccinated, at least partially. So when 96% of adults are immunized, so chances are that those 4% are only very minuscule portion. Majority are, most of these are. So getting breakthrough infection in adults with immunization is not to be something to be very worried, because we know it's a vaccine is safe. But the important thing is that this, as I said, decoupling of severe disease and the infection. So that's important, and this is primarily driven by vaccination program.
Two questions by Dr. Atul Agarwal. If he is there, he can talk, because I had sent a link to him for specific time. When the younger children will be permitted for vaccination, is it required? First question, is it required? Or when
Gambhir,
they...
I'm online. I can talk to Dr. Arora, sir.
बोलो बोलो बोलो.
डॉक्टर अरोरा सर, गुड इवनिंग एंड चरण स्पर्श, उसके बाद मेरे सर 2 सवाल हैं.
Atul, please go ahead.
Sir, पहला कि first, when the younger children, that means below 15, will be permitted, because I'm the only one in the Western UP who's having the Covaxin private center. I'm under a lot of pressure from the parents. That, they also know that the government has given the permission for 12 to 18, and they want their children to be vaccinated. They are not ready to send the children to the boarding and other schools. And second question, sir, I will directly.
नहीं पहला पहला one by one, sir, one by one.
Okay, it's all right, Gambhir.
अब यहाँ पर मैं बताना चाहूंगा कि अतुल मेरे गांव का है, मतलब हम लोग दोनों बरेली के हैं. So there is a very different relationship. So the whole issue is that all of us know that disease in younger children is very mild disease.
Yes, sir.
And Delta, which was much more severe infection, even there, Miss C, etc., was only case reports from across the country. At some large centers, these patients were seen. Although it is, as I heard in various fora, that steroids were used in a lot of children who came with fever, some rash, diarrhea, 2 to 3 weeks after the onset of history of COVID infection in the family, or positive after COVID. So that also is there. But anybody, we have been looking after children, that serious disease is not severe, or most of the times it is asymptomatic. So actually, overall, if we see, many countries and people in many of the high income countries where it is freely available for children, they are not going in. The coverage is very low. But 15 to 18 behave very much like adults, and that is what the decision was taken. And we thought that we should be able to complete the 15 to 18 by 31st January, because we started on 3rd January. So the way it took off, in about 15 days, 60% mark was covered up, but thereafter it has slowed down. It is just around 4.8 crores or so far out of 7.4 crores. So our primary objective is that we should take care of our 15 to 18, because whatever that they behave like adults. The second is their movement and other issues. They are in various board classes, 10th, 12th classes. The third is many of them are working also, we know, and so they work outside and can bring infection into their homes. So that have been the various factors. But for younger children, the concern is really not very high. Once these children are covered up in next 4 to 6 weeks, I would think, when second dose is also given in about by end of March, I think things will also become much clearer in terms of the stage of epidemic, and then we will take a decision on that.
Thank you, sir. Sir, my second question is, as a vaccinologist and at various posts of vaccinology of IAP, we always follow the recommendation of manufacturer for any vaccine. In this case, Bharat Biotech has suggested whatever the booster or precaution dose you say after 6 months. Why we are not following that recommendation in case of Covaxin? That's my question.
So, say after all, the manufacturer gets these guidance based on some studies and regulators this permission. We know that in pandemic situations and otherwise for public health, off-label guidance is very, very common. For example, polio intradermal was never was considered to be intradermal IPV, but India was the first country started using it, and now rest of the world is using it. Similarly, I do not know how many of you are aware that in Argentina, by single dose of hepatitis A vaccine, they practically eradicated the hepatitis A infection in that country. So, for public health, off-label decisions are made, and that is what happens particularly in a disaster management pandemic situation as it is today. But in peace times, in regular situations, what you're saying is absolutely correct. Uh, the issue of 6 months from Covaxin is also they did not have data. It was more based on circumstantial and mathematical modeling, the way the antibodies will decline. But actually, for how long it works, it is not known. So we will not go into that nitty-gritty, but as I have tried to explain, for public health purposes, decisions are making on various studies ongoing and the overall public health impact of a problem like COVID.
Thank you, sir. Thank you very much. बहुत अच्छा लगा, sir, talking to you directly, sir.
Thank you,
Gambhir, you
Vijay.
can go
Always
ahead with the
welcome.
other questions.
Ajay, I'll have to
इसे
leave in about 5. I'll have to leave in about 5-7 minutes. मेरे
ओके
there is another meeting. Okay.
रिटर्न ये आपको देख के चुप हो गया. मेरे को जो क्वेश्चन भेजा था उसमें अतुल ने लिखा था आई वांट साइंटिफिक आंसर एंड नॉट लॉजिस्टिक और गवर्नमेंट पॉलिसी.
सर ने जवाब दे दिया. Gambhir, he
बस
has already answered that for the public purpose.
चलो चलो चलो. अच्छा, दूसरा अब एक और क्वेश्चन है कि व्हाई नेचुरल इम्यूनिटी. अतुल मैंने इसलिए
Just a minute. Let me satisfy Atul. So 9-month period was basically given for breakthrough infections. So all the injections which are given through COVID, and the ICMR testing portal, it is being monitored, and till about 6, 7, 8 months, the breakthrough infections are very less, about 1 to 2%. When it starts reaching 9 months, then it becomes 5, 6, 7%. And that is the reason that this decision of 9 months was taken. So it is based on, I must tell you, most of the decisions which are being taken are based on science.
Thank you, sir.
Sir, the question is why natural immunity does not seem to work on Omicron. Is it true?
So the hybrid immunity seems to be the best, like our country. As I said, most of the people have been infected with Delta virus or the Wuhan virus. On top of that, we got vaccine, and now a lot of us have got natural exposure to Omicron. So we are in a very unique position. But standalone natural infection gives you protection for 6 to 9 months, and thereafter you become vulnerable for breakthrough infections. But still, there is a conflicting information. But it appears that after a natural infection, if you get a reinfection, which is called reinfection, then the severity is always less, and risk of hospitalization and death becomes extremely uncommon.
So last question from my side, then Dr. Grewal, who is working with the elders, may have. One doctor asked, most of our hospital doctors who had a booster had malaise and myalgia for 10 to 12 days, while the other symptoms were okay in 2 to 3 days. Are you following this? Or is there any specific reason?
Yeah, we are aware of that. And this must be particularly happening with Covishield. And so this is known, and that is precisely the reason that heterologous vaccination at this time we didn't go, because good evidence was not available. The safest way was to have an additional dose of precaution dose.
Dr. Grewal, Bobby has left. So if Bobby is not there, one more question, because you are in COVAX. So is Omicron, as per the WHO chief statement, there have been more deaths in last 6 months rather than before that. So is Omicron leading to more death?
No. In last 6 months, the basic havoc has been caused by Delta in different parts of the country, in different parts of the globe. So it is primarily Delta. Omicron has come in only for last December, January, 10 weeks only. So prior to that, it is Delta. And I must tell you, in most other parts, it was Delta. Omicron has started taking over only from December mid in different parts of the world. Wherever prevalence is going on.
Okay.
So in our own country, it is very beautifully, the data is that in Delhi, the Omicron became dominant much faster, and as compared to Chennai, where there was a gap of, so between Delhi and Chennai, Delta was replaced by about delayed by 3 to 4 weeks. So this will keep on happening, but across in last 6 months, whatever has happened is primarily Delta driven. Whatever high death rates you were seeing in USA and North America and Europe was mostly Delta.
So you have been part of the COVAX and with WHO. Do you think the larger strategy of equity? One question was on that. The larger guidelines of the equity is important to control these viruses for the future.
Yeah, absolutely. And in fact, only yesterday we had a meeting of COVAX. The WHO has come up with a phase 2 strategy. In phase 1, 1.8 billion doses have been allocated. They will be dispatched by 31st March. From 1st April onwards, phase 2 will be there, which will be more demand driven. Today, almost 8 to 10 billion doses will be available in the market for the world, and India would be a major supplier in that case. And so from an equity purpose, I think situation is better. Last year was all vaccine nationalism, vaccine hoarding, and stockpiling even when people did not require it. Many of the countries did that. But hopefully now, since the market is flooded, uh, people across different countries and geographies will be able to get the vaccine.
So last 2 minutes, I'll ask Deepika to see. Yesterday I was in Aurangabad and people were appreciating INSACOG, and because this meeting was basically for a public-private partnership of Sterlite and Rotary of the Breast Milk Bank, and then because the Path Foundation had donated the PSA oxygen concentrator and also the thing. So Dr. Bajaj, she's here, and with the team. There's another photograph, Deepika. Yeah. So this is Dr. Bajaj and the PAR team, Dr. Deshmukh, who is running a neonatology center for the breast milk, and with the team. So they were very happy. The support coming from Delhi and the guideline coming from the NCTC and also from the team of Dr. N.K. Arora. So we appreciate your feedback, and I again feel that some more data for the civil society to push the changes which we can do at some point, because we have taken few grants and funded through the Path Foundation to Aurangabad, where the first Omicron was detected. So if you keep on telling us, educating us, we'll be also pushing our agenda further. Thank you very much. Dr.
Thank you very much. Thank you. My pleasure.
नहीं
Sir,
लतिका
आप
ने आपको हेलो बोला, आवाज सुनी उन्होंने, इस पर तो बोली है।
अच्छा अच्छा अच्छा, गुड गुड गुड। ऐसा है कि देखो
Dr. Subir Mujumdar, I think, wanted to speak out.
हाँ प्लीज प्लीज।
Yeah, I just wanted to ask कि जो precaution dose है जिनको comorbidities है 18 to 60 years में या 18 to 59 है, उनको क्यों नहीं दिया जा रहा? Because comorbidities should also be part of the precaution dose policy.
सर जहां तक मेरे को पता है एडमिनिस्ट्रेटिवली डॉक्टर अरोड़ा तो चले गए बिकॉज ही हैड टू बी 5 minutes early. This is on the administrative side and stratification giving to the healthcare workers, doctors and the frontline workers. And I think the next stage, because अब इनके बाद extra dose आएंगी, तो next stage is to involve the senior citizens.
I think senior citizens are still getting the precaution dose.
Yeah, senior citizen is started. My mother-in-law took the dose.
Yeah, senior citizen has also started.
हाँ, तो 60 से कम भी जिनको comorbidities है, they should be, I think, next on the pipeline.
Because the data they are getting on the daily basis, the risk stratification, because they are seeing 40 to 60 में इतने cases admit नहीं हो रहे हैं. Maybe you are right. We are all productive. 40 to 60 is the very important stage. So we'll push this agenda. आप queries दे देना and they will give us the answer why they have not, or maybe they are planning to do it from the next month. So they'll let you know.
Thank you.
Thank you.
थैंक यू डॉक्टर गंभीर।
डॉक्टर राय भी ज्वाइन है, कुछ बोलना चाहते हो? थैंक यू अतुल। वी टोल्ड दीपिका टोल्ड कि भाई अतुल को बुला ही लिया जाए, मतलब व्हाई ही शुड बी, रजिस्टर नहीं हो रहा तो उसको बोलने दिया जाए।
थैंक यू।
अब ये बताओ बीजेपी की टिकट कब ले रहे हो?
जैक्सन पॉल
नहीं, आप बीजेपी की टिकट कब ले रहे हो ये बताओ हमें।
अरे यार बहुत मुश्किल काम है, पूरी डॉक्टरी
नहीं, टिकट ली नहीं जाती, टिकट दी जाती है।
नहीं, ये जब मोदी जी आते थे तो अतुल उनको माला डालता था, तो मेरे थी एक हमारा डॉक्टर आ जाएगा जो वैक्सीन के बारे में पूछ करेगा।
बरेली से 3 डॉक्टर खड़े हो रहे हैं, 3 अलग अलग कॉन्स्टिट्यूएंसी से, तीनों के लिए लगा हुआ हूँ।
कौन है? 3 कौन है?
डॉक्टर अरुण कुमार है एक, देन डॉक्टर राघवेंद्र शर्मा, ही इज अ वेरी सीनियर, मतलब मेरे से तो जूनियर है तीनों ही, एंड डॉक्टर MP आर्या। 3 अलग अलग कॉन्स्टिट्यूएंसी से 3 डॉक्टर हैं, चौथे वेटरनरी डॉक्टर हैं।
गुड।
नहीं, आजकल जूनोटिक डिजीज आ गई, हमें वेटरनरी डॉक्टर सबको साथ लेके चलना है।
ये सुने साथ में लेके चलेंगे।
चलो डॉक्टर आए, कुछ फाइनल वर्ड्स फिर बंद करें हम।
नहीं, बस बिल्कुल ठीक है। थैंक यू वेरी मच, a nice program you have kept it, and nicely Dr. N.K. Arora has explained everything. There are a lot of still queries in the mind. Slowly they are getting cleared, because at that time I could not unmute myself, and I was getting some line also. And my question was, and you can also reply me, people, I mean in the Europe and in America, they are promoting the cocktail of the booster dose. Whereas in India, they have clearly mentioned if somebody has taken Covaxin, he will be he will be taking Covaxin only and not the Covishield. What is the difference, or what is the advantage or disadvantage in that cocktail?
Sir, few countries have allowed, not all the countries, because India, it
Few,
is a
I'm telling you, few. Europe and America and in England also.
yeah, because still they have not been able to control, because our is a centrally controlled, as we ask about emergency use authorization and conditional use authorization. And wherever you take, whether you take on Atul Center or My Center, it has to be put on the website with your Aadhaar card and identification. So government has all the data and government is trying to collate. So they did not find any advantage. Number two, our mechanism for adverse event is not that strong as in the Western countries. And once there is a loss of confidence because of any event, the public starts going here and there. So that is what the reason, though the science says that the antibodies formations could be better, but the other part is which he has told you that the complication may be also be more. So that is the reason on the to be on the protective side they have done so. And maybe they told the split vaccines are coming, 1/10 dose of Covishield will with Covaxin is coming, they will be allowed that. So this is all on the drug controller general of India, and another 3 months we'll have a lot of vaccine with a lot of combination. So we are
one
not
of
that.
one of my friend went to America for attending the conference, and he had both the doses. But when he landed in America, even he was advised to take the booster dose or third dose, whatever you want to label it as, Johnson and Johnson, and he took there. But I mean, that was the thing I wanted to clear.
Sir, you are our TV face. You are most of the time on the TV, but they have found out that the booster dose, WHO and American data are coming, the booster dose is not helping. So it is of no use, unnecessary. India, the economic factor, the logistic factors. So we thought the 2 doses are good enough, and I think we are on the right track. The data says we
we'll
are
have
on
to
track.
come out of the extrapolating the American data now. The way they had the death and the cases, such a developed country, and if we compare with the India, now we should stop extrapolating the American data to the Indian context.
Atul, you are absolutely right. You know, the way Europe has behaved or the America has behaved, it is literally horrible. And then we are proud to say that India has controlled very nicely, and we have achieved whatever we want to do. And today also the peoples, I mean, in America and in Europe, peoples are not following the appropriate behavior of the COVID. They are reluctant to use even the mask also. So that is the main biggest
Canada
reason.
is a glaring example, sir.
Eh?
Canada, you see
Yes,
what
Canada.
is going on. Yes.
Right. You are absolutely right.
Sir, this was a tool. The only tool the politician had was the vaccine, and they started promoting it right, left, and out. But it had to be promoted with the scientific evidence and slowly. And the countries who have not even started the vaccine, the COVID is gone. So the issue is people are still asking. There are a lot of lobby, there are a lot of experts, a lot of people have resigned from CDC and WHO. They are asking why the vaccine was pushed beyond a point. So issue is giving a vaccine, appropriate use of the vaccine, or pushing of the vaccine. So they are two different things. And Pfizer, especially the drug coming from Pfizer, some companies promoting different type of vaccine. Now multivariant vaccines are coming. It will have all the things. So this is started developing Denmark. So a lot of things will come, whether it is required or not. That is the thing. Like a flu vaccine, everything is not hunky dory, and we are going to be safe with any vaccine. So with all these things, I think I'll ask Deepika. Deepika wants to say something.
Yes, sir. Thank you so very much. Thank you for organizing such important topics along with taking Jagsonpal along with you. Jagsonpal brings to you many products which can be patients. One of those could be LycoRed. LycoRed, the only brand which contains lycomat, which is 100% natural lycopene source, along with phytonutrients. So it has the whole bioenvironment to give the strength which is needed by lycopene to work on your immunity, enhancing the immunity. Also, we have other products like Doxypal DRL. We have Doxycycline 100 mg capsules. And then we have Parvon 4, that is paracetamol, which has been newly launched. That is 1000 mg. So we keep having these webinars. This is a webinar which is being organized by our Delhi societies who have come together, Delhi NARGI, the Gynae Society. So do join us on 12th of February. So Looking forward to see you, because the Zoom ID is mentioned over here. If anyone is interested, you could note down and register today itself, so you get the reminder for the program. Thank you very much, Dr. Gambhir, and we hope to be associated again and again with your programs, sir.